Good evening, delegates and participants. Thank you for joining Shield Connect. Today we are back with Dr. Ritu Santwani series, and today ma'am is going to present on the topic patient awareness on cervical cancer and Pap Smear test. So let me introduce Dr. Ritu Santwani ma'am. Ma'am has done MBBS, MD, FICOG, FIOG, MRCOG. Ma'am is obstetrician and gynecologist, IVF specialist. Ma'am is founder and CEO of 360 Degrees Healthcare Studio. Ma'am is also consultant in Inamdar Multi-Speciality Hospital in Pune, and ma'am is infertility test tube baby specialist. Ma'am is also part of NUHS from Singapore, co-founder of MAAM and board member of WSCG. So ma'am, I welcome you on this platform for today's webinar. Thank you, ma'am.
So, thank you, Nishan. Very good evening to all of you. Actually, this is a very auspicious days are going on. As all we know, this is a Navratri time. So today me and Nishan discussed that we will take in this week a topic like that, which will be useful for everyone. And we all know the incidence of cervical cancer is very high in India post breast cancer. So today today our program is focused on the patient awareness for the cervical cancer and the Pap smear. So बहुत सारे पेशेंट्स आते हैं जिनको इसके बारे में बहुत सारी क्वेरीज होती हैं. The program is going live on the YouTube, so it will be benefited for everyone. So our conversation will be in mixed English and Hindi, so it will be useful for everyone. So I am able to see some of friends have joined. Yeah, hello, Dr. Nilofar, how are you? Yeah, hi, Dr. Mahima, good to see you here. So I will start sharing my screen. Slides are visible, na, Nishant?
Yes, ma'am.
Okay. No, why it's not moving? Yeah. So, as we all know, this is a very auspicious time of Navratri is going on, and today is the 4th day of Navratri. Ma Kushmanda Stuti we all are doing. So, I will start my presentation with these two lines. Ya Devi Sarva Bhuteshu Chikitsa Rupen Sansitha Namastasyai 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 Namo Nama. So friends, today we are going to discuss regarding the cervical cancer and Pap smear. So actually this slide is the main, it is the brainchild of Dr. Nishant, who is with us. So he tried to simplify it a lot within this presentation. So I'm thankful to Nishant. Nishant, thank you so much for this. So yeah, so here we do not want any woman suffering from the cervical cancer. So friends, we know the cervical cancer is responsible for 6.6% of the female cancer deaths worldwide. So with this, we can estimate that how much is the incidence of the cervical cancer. So we will take one by one. Every year, 1.3 lakhs plus Indian females are diagnosed with cervical cancer. In India, 1 out of every 2 women die of cervical cancer in India. As we all know, the HPV virus is responsible for the cervical cancer. It can take 10 to 15 years for the cervical cancer to develop in a woman with normal immune systems. HIV positive women are 5 times more likely to develop the cervical cancer. So that's why it is very, very important whenever we are counseling the patient or checking the patient in our OPD, we tell them that what's the importance for this HPV virus. Why once this HPV virus screening, PAP screening is very, very important. Because see, in the second line, it is clearly mentioned that it takes almost 10 to 15 years for the cervical cancer to develop in the woman with normal immune system. So if the immunity is low, the chances of the getting infection with the viruses is more. So, so now what is this cervical cancer? As we know, friends, here we can see the cervical cancer. Cervix means the mouth of the uterus. So it is the most common form of the cancer in worldwide. Second common cancer in women in India after the breast cancer. According to WHO, almost all cervical cancer cases, more than 99% are linked to infection with high-risk human papillomavirus and extremely common transmitted through sexual contact. Soon we will come with another lecture on the sexually transmitted infection, because these days so many patients are coming and having a query on the different sexually transmitted diseases. I am seeing too many patients of this STDs these days. So there are a lot of queries related to that. So now related to the cervical cancer, as we all know, the cancer that occurs in the cells of the cervix, lower part of the uterus that connects to the vagina. HPV is the main virus, which can pass from one person to another person while during the sex. And at least half of the sexually active people will have HPV at some point in their lives, but few women will get the cervical cancer. This is a very common question the girls ask in the OPD, ma'am, why it is necessary to screen? Is it like that everyone will going to get the cervical cancer? No, once the immunity is less, the chances of getting infection by the viruses are high. So that's why the screening is very, very important. So what are the complications associated with the cancer? As we all know, pain during the growing phase of the cancer, kidney problems, swelling of ankles and feet, blood clots as the blood becomes thick, bleeding tendency increases, shortness of breath, fatigue, blood in urine, fistula and stroke. So the sign and symptoms of the cervical cancer, we can see, friends, very important, with which the patient usually comes: bleeding during sexual intercourse or 2 menstrual periods or menopause, blood-stained vaginal discharge with a strong odor, pain in the pelvis. Rarely there is the presence of a vaginal mass, lack of appetite, unexplained weight loss, pain in the back and legs, fatigue, heavy vaginal bleeding and bleeding after pelvic examination. तो इसमें से बहुत सारे जो पेशेंट्स आते हैं हमारे पास, वो यही कंप्लेंट करके आते हैं that mostly they are having a bleeding after the sexual relationship. Some may complain with a strong odor also, that is also very common symptom. And if the cancer is in the advanced stage, with the lack of loss of appetite, unexplained weight loss, fatigue, with these the patients present. But I practice in Pune, one of the metro city of India. So here, what the patients I am getting who are having a, mostly once the patients are coming with the complaint of the bleeding post relationship, a very common complaint, or the foul smelling vaginal discharge. So now what are the causes and risk factor? As we all know, HPV virus is the most common cause. Then again, the gene abnormalities has been reported when the healthy cells in the cervix develop the changes, mutation in their DNA, greater chances of acquiring HPV by having sex with multiple partners. So this is also very, very important. Once we are asking the patient, so history, we ask the patients clearly about the history, about the with the relationship with the multiple sexual partners, early sexual activity, other sexually transmitted infections such as chlamydia, gonorrhea, syphilis, and HIV, weak immune system, smoking, exposure to miscarriage prevention, and family history. So here we can say these all factors are having a role in the contribution of this. So now why the screening is important? Most of the time, the women do not know that they have HPV until the changes in the cervix are detected, and the men generally do not know that they have the viruses. That is the just one reason why the screening is so important. The cervical cancer burden in India, 1 in 50. Indian women will develop cervical cancer in their lifetime. The second most common cancer after the breast. So here again the incidence is shown that 67,477 women die every year due to the cervical cancer as a result of a late diagnosis. When I was in medical college, so I was in the government medical college from KGMC Lucknow. So there we have seen so many patients are coming with this advanced cervical cancer. Patient comes with a big mass on the cervix, which is bleeding. But now these days, yes, of course, the awareness is much more. So the patients approaching to the doctors little early. So in every year, 17 to 23rd January 2022, in every year, 17 to 23rd January is celebrated as the Cervical Cancer Prevention Week. So to reduce the cervical cancer, there are the preventive measures like lifestyle changes and diet modification. Of course, the quitting of the tobacco and HPV vaccination, having a routine Pap test, practice of the safe sex, consistent and correct use of condoms can help to prevent the HPV infection. Smoking cessation, women who smoke are about twice as likely as non-smokers to get the cervical cancer. So what are the 3 simple steps for this? So here we can see the HPV vaccination, Pap smear test and HPV test. So vaccinate, Pap smear and HPV testing is very, very important. Just a second. So we all know, just a second. We all know that these 3 all plays a very, very important role for the cervical cancer prevention. So we always advise to go for these. So among this HPV vaccination is a non-enveloped DNA virus with 100 different types, but the infection with HPV 16 and 18 represent around 70% of all the cervical cancer cases. Adherence to routine Pap test still continues to be a non-satisfactory, especially in the large population like India. Vaccination is one of the best forms of the prevention. So in India, we know the Cervarix is available, Gardasil is available. Now the Nano Gardasil is also we are giving, which is covering the 9 strains of this. So with this Gardasil, which is protecting from both genital warts and cervical cancer, while the Cervarix is protecting only against the cervical cancer. And one very important point to be remembered that these 2 vaccines are used as a prophylactic, as a preventive measure and not the therapeutic measure. This is once we are giving the patient the vaccines, we have to clarify the patient that these are the preventive, not the therapeutic. Nahi to patient was there now if we are taking this vaccine, even though we are having going to suffer from the cervical cancer. So what's the rule? So while doing the counseling, we have to properly tell the patients. So it has been recommended from the age from 9 to 45 years of age group. But for less than 14 years, usually the 2 doses are sufficient. As all the preteens had HPV vaccination, so teens and young adults through the age of the 26 years who did not start or finish the HPV vaccine series also need the HPV vaccination. So as I told, less than 12 years, it has been 12 to 14 years. We usually recommend for the 2 doses only, which are the 6 to 12 months apart. So here we can see for this Gardasil Nano or either go for the Nano Gardasil 9 or Gardasil quadrivalent. That dose schedule is mentioned is 0, 2 and 6, 0, 2, 6. in which 0.5 ml of the liquid suspension is given, while with Cervarix is the 0.16. All can be given by the intramuscular route. Now, what is this Pap smear? This is a very, very common query of all the patients. So Pap smear or Pap test is a quick, painless procedure that screens for cervical cancer. It involves the examining the cells taken from the cervix under a microscope. The test does not diagnose the cancer, but rather it looks for the abnormal cervical precancerous or cancerous cells that could indicate the cancer. If any are found, further testing such as a colposcopy or biopsy will be done in order to diagnose cancer. So now what's the importance of this Pap smear? We all know detecting the cervical cancer early with a Pap smear gives you a greater chance at a cure. Detect changes in the cervical cells that causes the cancer may develop in the future. Pap tests are very accurate. Regular Pap screenings may reduce the cervical cancer rates and mortality by at least 80%. So this is again a very, very common question, because most of the youngsters are coming and asking, doctor, is it necessary that I should also go for the Pap smear testing? So see friends, here what is the recommended by the CDC guidelines I am showing. Age group 20 or younger, no screening is required. 21 to 29, Pap test every 3 years, no HPV increasing screening, while 30 to 65 years, Pap test every 3 years, or a Pap test and with HPV every 5 years. 66 years or older, no more screening is required if you had 3 normal Pap tests or 2 HPV tests in a row now. So here, as it is mentioned that age 20 or younger, no screening is required, 21 to 29. But here, if the patient is having a history of multiple sexual partners, yes, in that case, of course, I am recommending in my practice for the Pap testing. So now, how to prepare the patient for this Pap testing? This cannot be done while the patient is on the periods. Heavy bleeding affects the accuracy of the test. Then for most of the accurate Pap testing for the following steps, starting from the 48 hours before the test: do not have sex or use lubricants. Do not use sprays or powders near the vagina. Do not insert anything into the vagina, including tampons, medications, creams, and suppositories. Do not rinse the vagina with water, vinegar, or other fluid. The test is done on your doctor office or at the clinic, and usually it takes hardly 10 to 20 minutes for the full procedure. Patient has to be tied down or lie down on the table with the feet placed firmly on the strips. We tell the patient to spread up the legs, and doctor will insert a metal or plastic speculum in the vagina, and this opens which widens the vaginal walls. This allows them to checking of the cervix. The doctor will use a swab to take a sample of cells from the cervix. They are placed into the liquid substance in a small jar and sent in the lab for the testing. The Pap test usually doesn't hurt, only a little bit of pinch or pressure like patient may feel while we are putting the speculum. So again, the other important query which comes from the patients, that how long does a Pap smear take? A Pap smear takes only 1 to 2 minutes, but the entire appointment may be longer. Sorry, just a second. Yeah. But this entire appointment may be longer. This is because the Pap smears can be performed during a regular annual gynecologic visit. Pap smear results will take in 1 to 3 weeks to appear, but these days sometimes by LBC reporting we are getting early also. If 3 weeks has been passed, then again we have, this is the instructions for the patients what we keep. So the results may come either the positive screening or the negative. And if it is positive, then the doctor will discuss about the for the management. So, yeah. And if the tests are abnormal, means if the results are positive, it does not mean that you have cancer. There are the several reasons for abnormal Pap smear, either maybe due to mild inflammation or minor cell changes, HPV or other infection, cancer or pre-cancer, lab test error. A Pap smear considered to be a safe procedure, but it is possible that the test may miss some abnormal cells or a cervical cancer. And then in that case, to talk to the doctor about the benefits and risk of the cervical cancer screening. Based on the Pap smear, early treatment can be given. If the abnormal cells from the screening test is called, then the patient is called for the colposcopy. Then treatment depends on how normal are the cells. The doctor may remove the areas of the abnormal cells, and you might have to have the treatment that kills the normal cells. Sorry, no. Where the treatment which will kill the abnormal cells, not the normal. Sorry for the slip of tongue. Then removing the area of the abnormal cells are different procedures. Actually, I'm only naming the procedures because for the layman to know about the detailed procedure is little difficult. Either we going for the LLETZ, that means large loop excision of the transformation zone, or in which is the most common treatment for the abnormal cervical cells. So can be done under local anesthesia. Then the needle excision of the transformation zone, or the cone biopsy, or the last resort is the hysterectomy. I've just mentioned this, the procedures what has been recommended, because these days whatsoever the patients are coming, patients first do all the googling and then come to the doctor. Treatment is to destroy the abnormal cells. So here we can see either by the cold coagulation or by the freezing. So compressed with the nitrogen gas flows through a cryoprobe and making a metal cold enough to freeze and destroy the abnormal cervical tissue. So with this, the take-home message is the friends, today's our talk is based on the patient awareness. So the cervical cancer is a preventable disease. Routine screening save lives. Nearly 100% of the women diagnosed at the pre-cancer stage of the cervical cancer survivor. Our hope is that more girls begin getting the HPV vaccination in accordance with the recommended age guidelines of 9 years of age to eliminate the cervical cancer in future. No woman has to die from the cervical cancer. So again, I'm repeating here. So we have to tell the patient that this vaccine is for the prevention from the cancer, not the treatment for this. So with this, we will wind up, because today our talk is focused on this, the cervical cancers and the Pap smear screening. So vaccination is must. So thank you, friends, for your attention and time. So here I want to highlight regarding this HPV vaccination also. For the vaccination also, there are a lot of queries the different patients are having. Some are saying कि doctor, can we take अगर हमने एक शॉट गार्डासिल का लिया है तो क्या हम दूसरा सर्वरिक्स का ले सकते हैं? So no, this is also not possible. Whatever the vaccine is started, all the 3 shots you have to take of that vaccine. Other important query has come, doctor, if I become pregnant in between, so what to do? So friends, this vaccine can't be given at the time of the pregnancy. The rest schedule you can complete once you deliver the baby. Again, very important query come with this vaccine. Doctor, is it necessary to take all the 3 doses? If I have taken the 1 dose or 2 dose, is it not like that this is going to be sufficient? No. For the complete protection, you have to take all the 3 doses. So these are some very common queries which has come from the patient. So we tried to take that for today. So I think with this, Nishant.
Yes, ma'am.
Yeah. So with this, we can wind up, because our talk today is focused on the patient awareness for the, yeah. So
Kind of for the today's session, ma'am.
Yeah.
Okay, ma'am. Bye, ma'am. Dr. Varsha is raising hand.
Acha, okay. Yeah, hi, Dr. Varsha. I
Ma'am,
think
do you
by
have any query? Maybe no. She raised the hand. Okay.
so maybe by
So,
mistake.
yeah, so we can wind up for today's session, and we will be back on next Thursday with Dr. Ritu Santwani ma'am on another topic. So stay tuned with us. Okay,
Yeah.
ma'am. Bye, ma'am.
Yeah. Okay. Bye-bye. Yeah. Thank you, friends, for your attention and time. Thank you, Nishan. Thank you, Chitra. Thank you, Sheil Connect for providing the platform. With this, we will wind up for the today. Bye-bye. Good night.
Good night.